I'm Dr. Joy Siegel. I am a gerontologist. I am on the board of the Alliance, and along with Heather, I am the co-chair. And I again want to thank the Alliance executive leadership, the team, and our entire committee for bringing this program to you today. And we're very grateful for everybody's participation. I'm going to moderate this panel, and I'm going to start, before we kick it off, by asking everybody to introduce themselves, say a little bit about the work you do, and then we're going to kick it in and talk about each of your areas of expertise and how we can end up at 75 like our friend at the end. So I'll turn to you, Dr. Turner.
All right. My name is Dr. Arlena Turner. I am a research neuropsychologist and a sleep specialist. So I focus on researching. Oh, sorry. I guess everybody's awake now. I focus on researching the connection between sleep and health in general, but specifically sleep and Alzheimer's disease, especially in minoritized populations.
Good afternoon, Narendra Kinney. By training, I'm a pediatric emergency physician, which is about the furthest away from this grouping. However, I'm here because of my interest in the interaction between the environment and health, especially in the aging. And the trigger for this research and for my activity actually was my father, who unfortunately developed Parkinson's, and he passed away from complications of Parkinson's. But the reason I'm here is the eventual cause we discovered was an intense exposure to a combination of compounds, which was herbicides that he used to use in his garden as well as insecticides. And he did that with bare hands and things of that nature. So we were able to find proof that was directly linked to the neurodegeneration in him, and that triggered a long journey in terms of how does the environment affect human health, especially as you get older.
Great. Good afternoon, everybody. Really excited to be part of this panel and have this discussion. I'm Paul Estes. I work for a medical device startup company. I've been there for 15 years. Our product is a 10-minute computerized assessment that gives you an idea of how you're doing cognitively. It gives you a bunch of scores and gives the doctor or clinician an idea of how you're doing in a really quick and easy way. Happy to be here.
Good afternoon, everyone. My name is Rosie Curiel-Sid. I am a doctor and a scientist at the University of Miami Center for Cognitive Neuroscience and Aging. And I work with older adults who might have some concerns about cognition or their risk of neurodegenerative disease and their families. And we try to find ways to improve early detection of these diseases so that people can live healthier and more independent lives and, be connected to all of the resources that are available to them that they may not necessarily know about until they're confronting something. And so I just want to also thank everybody in this room that is a provider of these resources, because it makes such a difference in the lives of everyone. And thank you.
Thank you. I'm Ed Begley. You heard plenty about me already, so I'll shut up basically, but just make one important point. I talked about the hope environmentally with what we've done with the cleaner air and cleaner water, even though there's a lot more people. Also with Parkinson's, I've had it since 2004, no question, diagnosed in 2016, and I'm doing very, very well, and that's what you can do with something like that with the help of experts like we have in this panel. Thank you all.
So our topic today is enlightenment on the path to aging. And I think with Max's presentation and what we heard from Ed, there are some woven concepts that really will apply to all of us relative to our lived experience, right? How do our stories create our future? How does the community help us get where we're going? And what is our power of connection? So I'm going to start with Paul, if you're okay with that, to focus on the power of connection relative to being your own advocate, and then we'll tap into each expert.
Yeah, that's exactly right. So in the healthcare landscape that we are today, we don't always have the luxury of being proactive. So being an advocate for yourself as the patient, as the person, is becoming imperative. And having advocates whether they be family or organizations, Alliance for Aging being a wonderful example of that. It's just becoming more and more important that you advocate, and it's a very, very encouraging place to be right now, because there are so many new things coming out every day, every week, every month. So the thing that comes with the advocacy is the education and awareness, right? So as a patient, you need to be more aware and more connected and more educated now than ever before, because there are so many different things out there. So I think just continuing to be an advocate for yourself, for your family, understanding what is available to you, great examples of things like that. The annual wellness visit isn't something that's taken advantage of enough in a healthcare setting. It's available to anybody over the age of 65 to do it yearly. Gives you a really comprehensive look at how you're doing. So just making people aware of those things and educating goes a long way.
Dr. Turner, how would this relate to our sleep?
So you're the expert on you. So you'll feel when there's something wrong or those differences. So the point of that kind of connection would be that education, understanding how to be able to advocate for yourself. How to say, okay, I knew something was feeling off a little bit, but now I know, oh, I've only been able to sleep, 5 hours. You're supposed to get 7 to 9 hours of sleep a night. If you're not falling within that 7 to 9 range, you can see that there may be a problem. And now that you have that education and that connection from other people saying, oh, I've had this problem too, you can use that to advocate for yourself. So it's really kind of, I think, about the education and the understanding that you are not the only person who's kind of dealing with an issue, especially when it comes to sleep in a society where we kind of just push sleep off to the side.
Dr. Koenig?
So let's start off with the sleep equation. Basically, let me try to tie this down to the environment, and let's see whether we can bring it down to all of us in the room here. So how many of you sleep with the lights on? Just raise your hands. And you require lights to sleep, or have any sort of light in your rooms when you're sleeping? Is there any light in your bedrooms? If you do, raise your hands. How many of you believe that you have the right mattress when you sleep? Have you ever contemplated that as a predictor of how well you sleep? How about sound? Anybody bothered by sound? Okay. One last question in terms of sleep. The best sleep that you've ever had, do you know when you started to sleep, what time of day? Do you think there's a correlate between when you actually sleep and the quality of sleep, rather than the duration? So I picked 3 numbers for you. Between 7 p.m. and 9 p.m., 9 p.m. and 11 p.m., and after 11. How many of you sleep between 7 and 9 on a consistent basis, 5 days a week? Raise your hands if that's a pattern. If it's variable, I can tell you all these 3 are tremendous determinants of your sleep quality. And they affect what's called your circadian rhythm, which, by the way, could be one of the #1 predictors of the ability to influence neurodegenerative disease. That data is becoming clearer and clearer. So you have many things that you can control that can actually drive better sleep, is what the data in the environment is beginning to tell us. That's a great example of the correlate between the environment that you don't think about and your actual health or your wellness.
Great. Well, I can comment about sleep if we're going to stay on the sleep path. Dr. Turner is our sleep expert on the panel, so questions can go to her. But I will say that sleep. Did you know that sleep is unequivocally one of the pillars of health today? Raise your hand if you know that. Yes, great. The message is really getting out. Sleep has so much research behind it now that we know that it's not only essential for your brain health, it's also, poor sleep is also related to neurodegenerative processes and the acceleration of some of these processes. And so that's what I have to say about sleep. Although in general, one of the things that I was really captivated by when you were speaking was this turnaround when we think about aging this lifespan comes to mind, right? You think about aging and you think about lifespan. But really now, the emphasis is not so much on lifespan, but on health span. And what is that? That's a lot. Ed really spoke to us about health span and some of the ways that he has been able to make sure that he continues to have health and the ability to do the things that are important for him to do despite having this diagnosis for so many years. And so that's what I would love to also speak about, because sleep contributes to the health span.
I'm there. Go ahead, Dr.
And I just want to kind of bring it all together because, it's supposed to be about like empowerment. And a lot of that just kind of felt like a little bit of just all of the terrible things that happen if you don't sleep well. So the one thing about it is that sleep is modifiable. Like, you can make small changes, make big changes. You can be the one to take control of that. And so I think that is really the key takeaway of all of this, is that poor sleep can impact you in so many different ways, but you can also be the one to take charge. And it doesn't take a ton of money or anything like that. There are a lot of things that you can do that I think we'll probably circle back to do that.
Thank you. I do want to say, and pardon me, Oscar Lorente is a board member and a committee member. He's going to have paper and pen. I'll be picking up questions. So if anybody has questions, he'll be walking around a little bit. So we are going to have time for that. Dr. Creel, let's talk now more about the concept of health span and the power of connecting and learning and staying engaged.
Sure. So we try to think about, first, if you're mid-40s and beyond, regardless, irrespective of your knowledge about your own risk to develop a neurodegenerative condition, if you are mid-40s and beyond, you should be thinking about your cognition and all the different things that you can do to slow down your cognitive aging process. It's very important. Before, we used to focus on aging interventions or health interventions in aging during the last decade of someone's life or after they had known risk of disease, in this model of, wait till you see it to treat it. And that's no longer a good model, right? We don't longer want to wait to experience symptoms to do something about it. Instead, we know enough, science has given us enough information about the things that we can be doing midlife and beyond to try to live healthy lives and function in the way that we want to function to the best of our abilities despite having a chronic illness. 80% of people over the age of 65 have at least one chronic health condition that they're navigating. And that's pretty substantial. And so how can we incorporate those things that science has taught us in order to live healthier lives? One of the very important things, because there's stuff all over the internet, some of it is really not supported by science, but some are. So one of the things that's very important, Joy, to your point, is social engagement, stimulation of your cognition by doing things that are novel and by doing things that really stretch your imagination, by engaging your brain. And that's also, to Dr. Turner's point, that's also not very costly. In fact, you're engaging your brain right now, right here and now. Just being present and paying attention and trying to learn something new and thinking about how you could be committed to action, to leave here and say, I can do this. I can do this today. I can do this now. So I want you to think about those things that you could do now to engage yourself, engage in cognitive activity that's challenging, learn a new skill, memorize some lines, learn how to ballroom dance, play a new instrument. We're in Miami, aprendan a hablar español, right? Learn a new language. So it's very important that you think about that, but social engagement, Joy, is so important for all of us. Everyone here has an opportunity to be rewarded just by sitting next to someone who's going to smile at you, who's going to give you their hand. That connection, we are built for that. We're human beings. We're built to be interdependent. We're built to love. we're built for connection. And as we age, sometimes, if you turn on the tube and you're watching television for 6 hours and you're in your apartment and you don't come out because it's too hot outside, that's a recipe for loneliness and disengagement, disconnection, low brain stimulation, and it's generally bad for your health, your physical health, your cognitive health, and also your emotional and spiritual health. So it's very important to keep that in mind, connection and engagement.
So, Paul, do you see the health plans, the durable medical equipment, the innovation companies considering this reality that the patient-centered care really starts with us, right?
Absolutely, absolutely. And to further some of what she said, it's so empowering these days with all that we've learned and continue to learn, knowing all of the modifiable risk factors that contribute to all the diseases out there and what we can do about them as patients. And as we're educated, we can take charge of that aspect of our life, right? So the exercise, the sleep habits, the social emotional engagement, the financial planning, all of the things that are really essential to living longer, healthier lives. We now have information at our disposal in the various, information everywhere, right? So it's empowering for us as the patients to advocate for ourselves, to learn for ourselves, and to take charge of those things that we can control. And we know that all of those contribute. And then all of the new technologies that are coming out are doing it in a way that we can actually reach the patients, right? So we all know the landscape of primary care and how difficult it is to see them because of how much is on their plate. So asking them to do new things and take on new technologies is difficult, but there are community events and other ways of being creative and getting these technologies to the patients. And that's I think what a lot of the innovative technology companies are doing is taking something that's was complicated or is outdated or could be done better and making it simpler and actually achievable within our health system.
Ed, I hope I don't blow a secret, but I asked him about his sleep since he's been diagnosed with Parkinson's, and one of the things he shared is that he gets up at 4:30 now. And what he does is he goes to the gym at 5:30. So it's really incumbent on us to be somewhat nimble, even during times of change and transition. Could you speak to that, Dr. Turner? How do your patients address that?
Well, so I think that's really the crux of it, is being nimble and being kind to yourself, right? So we tend to think of things a lot of times in black and white and in kind of stringent terms. So when I talk about sleep and when I talk about these things, you'll hear kind of broad spectrum, right? So I say you should get between 7 and 9 hours of sleep, right? Because we know that that's the range that is the healthier range. But I'm not going to tell you need to get 7.3 hours of sleep, right? Because everything is personal for you. You have to be able to move with the things that are changing. And if you wake up at 4:30, there's no reason to just lay there and torture your brain, right? You can get up, you can move around, you can shift the rest of things around to make sure that you are getting the rest that your body needs and being able to kind of move your processes through your life.
So Dr. Keeney, how do people respond to being nimble as it pertains to their environment? Because so many people want to age in place, right? Which is a concept, right? We can age in any place, but people feel so connected to their homes. How do we give them that kind of empowerment to be able to find comfort elsewhere if necessary?
I think it's very important to realize that there's a progression as you age in terms of how your body reacts. You begin to notice as your early 30s, I'm just making up numbers here, or you start to gray. Oh, wait, something's happening to me. Then your eyes kind of give way. Then the third stage, the musculoskeletal system, my joints and my muscles. Then you can talk about other organ systems depending on where you are. But as they do that, the environment that you lived in, the house that you bought when you were 30, no longer serves you when you're 55. And by the way, nobody in this environment today has seen fit to upgrade or change the house or where you live in as you age. That has not happened. So we kind of look at the 5 variables in an environment: the air, the water, okay, the surfaces, the habits, and I'll come back to that in 1 second. And then lastly, you can talk about a combination of factors on the outside of the environment. So let's go through those one by one. Your immune system is at its prime in your 20s and 30s. And you can argue about when the challenges from the environment start to make life miserable for you. But the air has 2 components, the pollutant component and the allergen component. You can handle those when you're younger, but as you get older, the reaction of the immune system starts to give you multiple issues in terms of wellness or your health span. I may be metabolically stable, but I may not be able to do my ADL, my activities of daily living, because now my allergies are overwhelming me. So I am older today. What do I do in this home? Have I bothered to look at the environment, the carpets, the paint? What is triggering me? And by the way, the number 1 trigger in terms of indoor air pollution, since I'm talking about the air, happens to be the combination of cleansing agents you use. And there's this hypothesis that the sterile environment is good for you. That's absolutely not true. We've disproven that in pediatrics a long time ago. So when you look at underneath your kitchen counter and you see 9 different chemicals, trust me, by the time you're 55, you may want to reconsider why on earth you have those. Because there's a dirty secret here. The EPA certified every single chemical individually as safe. They never tested all of those in the combinations that you decide on your own when you clean your home or do things of that nature. So please be aware that that soup you create when you clean your home, as an example, is a predictor of what happens to your respiratory system. Okay, that's one. That's the indoor pollution we're talking about. So you would talk about, how do I cleanse my air? Let's go to water. The city says the water is clean. Let's talk about something else in terms of the number 1 or number 2 determinant of your health. It is inflammation. And I don't mean acute inflammation from an injury. I refer to chronic insidious inflammation. And today, there are things that drive that inflammation. One would be plastics or microplastics. If you have a plastic cutting board, as a simple example, and you cut, do you know what number of microplastics then get into that meal that you just cut up on your plastic board? I'm giving you very simple, practical examples. And if you then scale that to look at the amount of plastic that's in your home today and how much of that becomes microplastics, which then drives chronic inflammation, you begin to realize that chronic disease is essentially caused by inflammation that stays. So as an environment, you've got to understand that these types of things, the air and water, are determinants, and therefore, as you get older, you can't take for granted anymore the water and air quality in your home. Let's go to surfaces. There are 2 types of things. Slips and falls are well known in the literature for the elderly. Oh yeah, sure. You're getting out of your shower is the number 1 risk. Getting off your bed is number 2 risk. And 3 are the gradation steps. Those are the 3 determinants of falls. But that's not what I'm referring to. I am talking about other surfaces in your home and how, as you get older, they start to impact inflammation and the possibility of infection. Your coffee maker and the height at which it is, along with the strength of your pronation, supination, is a direct predictor of whether you will be burnt. So nobody thinks of the activities you have and what happens as you get older. Opening a door in your home, or opening your wardrobe, or reaching up above 5 feet after a certain age is a predictor of a possible injury. Now, let me take the funniest part. You sit on a toilet bowl. Where is the flush? It's right behind you. So you have to essentially do something really awkward to flush. And you don't think about it when you're 25. But when you're 60 and you do this, there's a chance of shoulder stretch, ligamentous tear, and then pronation injuries. The same occurs with you plugging in when the standard socket is only 48 inches above. That means nothing to you when you're young, but as you get older and you keep leaning, you have repetitive injury. So the home, I can point out about 7 different locations where the home itself is a cause of disability, and that has not been addressed, okay? I'll drop off by telling you one last thing as we start to look at the home. Everybody's here has heard of the gut biome, and everybody thinks and agrees that the gut biome may be a predictor of health. How about the skin biome? It's even larger than the gut biome. And the skin contains probably even more bacteria, fungus, and virus combined in terms of per cubic meter than the gut. But what do you do to yourself every day that completely removes the entire population of bacteria and fungus on your skin? You scrub. You use loofah. You use fancy smelling lotions. All that was fine when you were 20, 30, and 40. But at 50, 60, and 70, those same lotions and creams and shampoos and things of that nature start to elicit a completely different immune response. And that has never been discussed as we've talked about aging in place. So there are 3 or 4 other categories. We don't have enough time to talk about them, but my research and where I'm going with this is how does one design the microenvironment where I live to be able to enable activities of daily living, as well as make sure that I temper my immune system and don't get more inflammation.
Thank you. I can't help but think, Dr. Curiel, that when you work with patients who are addressing brain health, some of these things, I'm sure you address these with creating a safe home environment. How do you speak to patients who have a recent diagnosis of mild cognitive impairment or perhaps mild dementia? Is this something you go over with them, with their families and caregivers?
Sure, absolutely. So the first thing is every patient and every family has its own microculture. They have their specific preferences, and it's very important to be a very good listener and to listen to the patient, to their families, listen to them independently without their families sometimes, but to see them as a community. You're there to assist, not only to diagnose with precision and to set a plan of care up, but also to say, okay, what's next? How can we follow up and make sure that you understand what has been shared with you? How much information do you want to be shared with you? Because we have a lot of information now, diagnostically. We don't have the same level of treatment options. And so people need to know, depending upon their preference, how they want information, who they want around when they are getting the information to help them navigate it, and how to move forward. Any doctor, any memory disorder specialist, any geriatrician, any primary care nowadays worth their salt is going to ask you about the way that you eat and whether or not you get outside and get some sunshine, who surrounds you every day and what kind of activities you're engaging in, because we have enough knowledge to know that the context in which we live our lives is really going to make a difference as to whether or not that plan of care that you're designing for that patient makes sense for them, and whether or not it's realistic that they're going to be able to carry it out, and whether or not they have the support and the resources to implement it. And by the way, Dr. Turner said, you are the expert on you. You know. So this process should be very collaborative, and it can't be done in one session. You have to come back. We have to do it together, and it takes a village. And it's very important for people to know that they're not alone as they age, that there are resources for them. So sometimes, some days I'm a social worker, and some days I'm a coach, and someday it just depends upon what that person needs. But I always, always, always try to be an educator. And being a good educator means communicating in a way that that person can really hear me and understand me. So yes, absolutely, all of these contextual factors are taken into account in our practice at the University of Miami and hopefully in most practices of people that attend to aging adults. And if not, because you are the most important person on that team, please be your own advocate and your own agent of change. Go in there with those questions. Make sure they're addressing all the things that are important, and take charge of those visits.
That's a great segue into what I want to ask Ed. You mentioned how your father impacted your life quite a few times, and certainly that's a massive part of the chapter you shared with us. So as you, 100 days from now, celebrate 75, how do you feel because that's why we have you here, right? Because of your lived experience. How do you feel about engaging your family today as you plan for your future? And I know the man works every day and memorizes his lines and is dynamic. So share with us how you feel about aligning with the resources you have now, which I imagine are your children, your wife, your community.
Thank you for saying that. I talked about not getting the part I wanted on St. Elsewhere and getting something much, much better, which has been a through line in my life the whole time. I have to credit my wife, Rochelle, because my dear friend Bob Hoskins had Parkinson's, and it was 3 years, wonderful actor from Great Britain, Bob Hoskins. He was in Who Framed Roger Rabbit, many other, Mona Lisa, many fine films. We worked together, very close friends. It was 3 years from diagnosis to death for Bob Hoskins, 3 years. So I thought that when I learned in 2016 that I had Parkinson's, I thought, wow, maybe I can squeeze 3 years out of this. My wife had other plans for me. She wanted me around longer. I was shocked to hear it. Very pleasantly surprised that she wanted me around a lot longer. And so she said, no, that vigorous outdoor exercise, indoor, outdoor, vigorous exercise is key to this. You've got to start going. I said, I go to the YMCA, it's fine, it's a good price, it's $39 a month, they're open 9 to 5, what's your problem? She said, because you work occasionally, you got to have a place that's open. She got me into a place, doesn't matter, but LA Fitness or someplace, they're open at 5 a.m. and they're open till like 11 p.m. It was life-changing. I go to the gym every day, every single day. Here I hit the gym here at this hotel every single day, vigorous till you get a sweat, exercise every day. It's been key. It's why I went undiagnosed for so long. I would ride my bike over from the valley floor in the San Fernando Valley up to Mulholland, down into Beverly Hills, into Santa Monica, to Ojai from Los Angeles. I just rode my bike all the time, ate well, and had a very healthy lifestyle. That's why nobody knew I had it. Why every year I go to see my neurologist about my Parkinson's. He goes, I don't know what you're doing, but keep it up. You're the star of the class here. If I'm grading on the bell curve, you're doing very well. So family has been very important to me. My wife had great ideas for me, and they've all worked very, very well.
I think that's really hard to get your posse together when you're vulnerable, you're scared, you're concerned about the future. And Dr. Turner, you mentioned that your area of expertise is with diverse populations and minorities. So could you touch on how your work is it different with different types of communities? Is the approach the same? How does culture play into aging with the work you do?
I think culture plays a big role into approach for everything, of course. But you approach everything with respect and understanding, and it'll take you very, very far. That's always the starting point. And again, we come back to, you're the expert on you, so listening and understanding, right? So, for example, when we're talking about sleep, if there's something that's impacting someone's sleep that is a cultural issue, you don't want to tell them, oh, no, this is wrong. You don't want to do that, right? You want to talk to them and understand what the cultural significance is and how we can get them to a healthier place while still respecting their cultural beliefs. So it really is about kind of focusing on meeting the person where they are and working with that person, regardless of what that culture may be.
Certainly everything we do in healthcare today has to be culturally appropriate. I want to ask if there are questions in light of time. I know some of you may be going back to work. Oscar, are there any questions that we have?
Any questions?
Oh, we have one up here. Oh, one back there. Okay.
Hi, everyone. So I have the honor of reading your questions. If you just be patient with me. It's been a while since I read something off a piece of paper. You all have fine penmanship. I'm used to reading text and emails. I don't need glasses, but I just put these on because they make me look really, really educated. Let's see. Mr. Ed Bagley, what has been the main issue that has helped you to have Parkinson's for over 20 years? You look great.
Thank you for saying that. Who was that? You that said that? Somebody. I feel very, very good, and it's because of a healthy frame of mind. First of all, I've been very good for years employing something called the serenity prayer. To accept the things you cannot change the things you can, and the wisdom to know the difference. So I thought, well, what am I going to do? My friend Bob Hoskins was dead in 3, maybe I'll get 3 years out of it. My wife fortunately stepped up and said, my kids too, I have a great relationship with my 3 grown children. They're wonderful. And they said they were very supportive of this, to, exercise a lot, eat good, get the proper amount of sleep. All that was essential to doing, what I've done which is to continue to work. I learned that I had in 2016, I went to several producers of 2 different shows, Bless This Mess and Young Sheldon. After about 2 years working on both those shows, I went up to them both. I said, I just want to thank you. You guys have been so patient with my Parkinson's. I hope I haven't cost any time or production time or slowed things down. They go, what did you just say? My Parkinson's is a problem with you twitching on camera. I said, no, we don't. You have Parkinson's? Neither of them had it. And I'm working this close to these actors and producers, for several years. So I'm doing something right. And it has to do with, also I had good luck. Not everybody maybe has luck with this, but I was told high doses of B1 and B vitamins can help a lot too, and something called glutathione has helped me. May not be for everybody. I don't know how it works, in clinical trials and what have you, but I've taken some of my wife's insistence, that helped. And just being healthy, eating well, sleeping, and that exercise, I can't stress it enough. It's the number one thing that kept me from knowing I had it for years. I didn't know I had it because I was just exercising very vigorously every day.
Thank you. There's another part to the question, and it has to do with sleep. The person wrote, it was my understanding that as you get older, 78, you don't need sleep. Maybe 7 to 9 hours?
Okay, I'm sorry. I didn't mean to react that way. You need sleep. Everybody needs sleep, okay?
She's 90.
No, so our sleep changes as we age, and the way that sleep changes has caused kind of a lot of myths. So there is more fragmentation. You are going to wake up more. There's going to be kind of a shift in your circadian rhythm a lot of times. So there are people who are waking up earlier, and so now all of a sudden they're feeling like, well, I don't need as much sleep as I used to. But when you really break it down and look into it, you're generally getting the same amount of sleep that you used to. There's just been a shift. And when you're like that fragmentation, you're waking up more, that's like you used to wake up like 1 or 2 times, now you wake up 3 or 4 times. It just feels like a lot more because you're aware of it. So everybody needs sleep. Keep that in mind. And then 7 to 9, are the healthiest spaces. So it, of course, sleep changes as you age. Babies need the most. They're at like 18 or something like that. Teenagers are pretty high up there, like 15 to 17 hours. As you switch into like these different places, and it has to do with the fact of your brain developing. And that's generally what it's doing, is that a ton of work with kind of memories and plasticity changes while you're sleeping. And so you do that your entire life, but once you're getting older, you're not having to make as many changes, and so you don't have to spend as much time in certain stages of sleep. And again, it's like you feel these differences and say, right, oh, I don't need this sleep, but you're actually getting it. It's just you now feel it a little differently.
Great, thank you. And after this conference, I'm going to go home and take a nap. But I'm going to introduce somebody. Well, actually, this person doesn't need any introduction, but she does want to pose the question herself. So I'm going to turn the microphone over to Ms. Ileana Bravo.
Thank you, thank you. I think this question is collectively for the whole panel, and that is that the mere part of aging does bring cognitive disorder into the picture. I know we're saying that chronic disease can be controlled. It's in our hands to be able to control and be healthy and exercise and eat right and all those things. But the fact is that we are at a critical level in this country where people over the age of 65, I believe it's probably 7 million people in this country who have dementia or Alzheimer's in some form, and those numbers are exploding. Are we prepared as a healthcare system, as an infrastructure to handle this? And is there a cure? Are there better treatments? Because at this point, Alzheimer's has no cure, and most of the dementias don't. So I'd love to hear your thoughts on this. Thank you.
Thank you for being here, Ileana, and it's nice to see you. What an important point I think she's brought up. We are at a point in human history that is wonderful because the population is aging like never before. And that is a gift in so many ways, something that we should acknowledge and embrace and support. At the same time, that requires preparation because, well, I guess the statistics say starting in 2011, those baby boomers turned 65, right? And so those boomers, the ones that we had to figure out how to educate when they got to elementary school, we didn't have enough schools for them. Well, guess what? Now we don't have a healthcare system that can accommodate this need. There aren't enough memory disorder specialists. There aren't enough primary care doctors. People are going into other areas of medicine, that give more money and are more specialized in this sort of thing. Our kids aren't going to college to be healthcare aides or even nurses. They're going into tech. And, we're not necessarily raising a society to be care providers. In families, almost everyone works now. There isn't, a person at home that's dedicated to providing care for their aging loved one. But families are finding themselves having to figure that out with not a lot of support, with the exception of agencies like the Alliance on Aging, the Alzheimer's Association, and these other very important programs that we should amplify and support. So it is not only a national priority, it is a global priority, the aging of the population. And everyone here needs to be aware of that and understand that, no, that's a very clear answer. We do not have the infrastructure. It does not exist right now. We don't have it in our society. We don't have it economically. We don't have it in medicine. But we need to build, and we will. We will build. There is no cure for Alzheimer's, and I don't want to monopolize the panel discussion. There is no cure for Alzheimer's disease, but it is a new era of treatment in Alzheimer's disease specifically. There, as some of you may know, the FDA has approved 2 novel agents very recently because the clinical trials have shown that there has been an attenuation of a pathological protein that accumulates in the brain of those that have Alzheimer's disease, beta amyloid protein specifically. And so it was approved by the FDA because the clinical trials showed that there was less amyloid in people who had these infusion drugs, but they didn't necessarily make a difference in the clinical outcome, in the way that people were living their lives, a little bit on a scale here and there, but not in a very meaningful way. It is, nonetheless, an advancement. It is an advancement. So yeah, there is no massive disease-modifying therapy, there is no cure, and there is no infrastructure, which is why everything that is being said here is so important, because you have to be the agent of change to make sure that you are taking care of yourself and your family and being like Rochelle and doing everything you can to age well.
Thank you. And before you go to the next question, Paul, do you want to
Yeah, I think the only thing I would add is it sounds a little bit of doom and gloom with the fact that the healthcare system isn't ready for it. It's going to have to adapt, but it's going to, and it has to, and it will. And then the other thing is, while there's no cure and these new therapies are coming out, there's more funding and research in the space than ever before. There are something like, and I'll get the number wrong, but something like 90 novel new drugs and therapies in phase 1, 2, and 3 that'll all be going through those and coming out in the coming years. So there's a lot of positive things happening in the space, as it does with, historically, we're always, when we're behind, we put a lot of resource towards it, and we figure it out and get to a place where it's better than it is today. So just.
And I just want to bring it full circle back to the empowerment. Like, that's what we're talking about here is hopefully the prevention. A lot of times what comes from that research is the understanding, and so we can pass on that education, that knowledge, that improving our sleep, working on the exercise. I'm not even where Ed is. I need to work to get there as well, right? But these different things that we can do to change and to prevent these things are also an advancement, and it's something that we can do and that we can focus on. I want to touch on, like, you made a statement, don't just curse the darkness, light a candle. And I think that that is the best way to kind of approach this, is looking at those things that we can change in that manner and moving forward that way.
Want to add something?
Yeah, I just wanted to make sure that we don't leave the environment behind. I would support what has been said, but I want to add one more step. If you're operating a senior living facility today, if you're in a nursing home today, I don't think the designs, contemporary designs of those environments today match the needs of the coming population with any sort of dementia. The risks to their daily living are higher than ever. Even our hospitals today are not designed for folks with cognitive disorders. An emergency room was never designed to have somebody who had an alteration in terms of their consciousness. And the same thing with the hospital bed or the hospital room. It was never designed that way. So what I would add is, in terms of risks that are non-medical, but things that would happen to a person, the facilities need to start to evolve very quickly to be able to adapt. Otherwise, you're going to have complications that are not necessarily medical in nature.
The good news is there are solutions, right? There are steps we can all take.
Yes.
Okay, Oscar.
Great, thank you, Joey. So this is a two-part question, and I think this person and I have something in common. The question is, what are some of the things that one can do to take to take charge of our sleep and to make our sleep better? The second part of the question, what can you say about the importance of taking naps?
Okay, I'm gonna start with the naps, because there's this huge misconception about naps, and everybody hates me when I tell them, but if it's longer than 30 minutes, it's not a nap, that is a whole sleep, and that's not gonna be helpful, right? So taking naps are very helpful. I take naps all the time, 20 minutes. Set a timer. And those are really helpful, kind of a reset. Those longer naps are gonna disrupt everything usually and aren't as helpful as you want them to be. So I will say yes, I agree with the importance of naps done correctly. And some ways you can improve your sleep are, I generally say, treat yourself better. Treat yourself the way you would treat your kid or a kid, right? Children have bedtimes, right? We need kind of more of a structure for our sleep. If you know you're getting tired around, let's say midnight. Okay, let's make midnight the bedtime. Let's get your 7 to 8 hours of sleep. Let's make yourself a schedule so that it's easier to make sure you're getting the rest that you need. Go through your day doing the things that are more taxing earlier. So if you're gonna do that exercise, doing that earlier so that it's not something that's gonna disrupt kind of that circadian rhythm, things like that. Be mindful of the things you consume, like don't drink coffee at 6 o'clock if you're gonna go to bed at 10 p.m., right? Just kind of paying attention and being more kind to your body, and you'll be able to kind of find different ways. Like if you look online, though, things like, they'll say like sleep hygiene, they're way more stringent than I would ever want them to be, right? It's like no caffeine after 5 p.m. That's a lot. I don't go to bed till midnight. Why can't I have caffeine? So I say like no caffeine 5 hours before bed, right? Things like that. So just making sure you're kind of thinking through the processes of what would lead to a better day the next day. So be kinder to tomorrow you, and you'll be able to, get that together within yourself.
Just one addition to that environment, back to the environment again. One behavior that's obviously more and more common is the use of screens. And I refer to them as screens, whether it be television, your iPad, your phone, and the time that you choose to look at the screen and how long you look at it before you actually fall asleep is a pretty good predictor of whether you'll sleep well or not. And all I can tell you is allowing it to be in a certain position, for example, a TV in your room is a predictor of you'll use it. Therefore, the quality of sleep probably will degrade. The same thing with having easy access to an iPad or phone and keeping it right next to you, staring at blue light for X amount of minutes is a predictor of bad sleep.
Yeah.
And those are all things you can control, and it's become habituated. People believe that it's a good thing to stare at something, read your screen. I can tell you that the data is showing very clearly that blue light and these devices are not compatible with good sleep quality.
I say for the blue light, I say an hour before bed.
Agree.
So I know that sounds difficult, but if you're creating your schedule, give yourself like this hour. It takes me an hour to get ready for bed. No, I don't know what I'm doing.
Absolutely.
I think, I'm just gonna get up and go to bed, and then it's an hour later, and I'm like, oh, okay, right? But then I haven't seen a screen for that hour, right? So making sure that if you cannot possibly tear yourself away from your tablet. I use my mom as an example all the time. She probably hates it, but she does her daily challenge. I think it's solitaire. That's the last thing she does before bed. And so I can't tear that away from her. It's her joy, and it's, challenging. And so we turn the night, or you can turn like the blue thing on, change it on the systems within the tablet, and I make sure she's wearing like the blue light blocking glasses, right? So there are things that you can do if you can't tear yourself away from things like tablets. I personally don't think TVs belong in bedrooms. I haven't had a TV in my bedroom since I could control that, so since I was like
Absolutely.
12, right? But, to each their own, but it's right, like an hour I think is the shortest amount of time.
Great, thank you. So this question is, with the exposure of microplastics and toxins, is the damage permanent, or if I make changes, is it reversible?
So that's a evolving science, but I give you the very quick answer. Microplastics have been found in the human testicle. I know that sounds gross, but that tells you the level of penetration of tissue. It's found in fish. It's found in literally every living organism. Once you have a foreign body, that's a plastic that gets into your system, the chances it will degrade and disappear are low. And the body is going to do what the body was designed to do, which is react to it from an immune perspective. It will surround it first and try to negate the impact it has on your body. So once you get microplastics, they're not going anywhere anytime soon. It will cause low-grade inflammation. What will happen, though, is you don't need to continue to accumulate more of that per kilogram of body weight. So there's a good news is, look, if you understand that these things don't belong in you, try to minimize how much gets in you. But once it gets in you, unfortunately, plastics have a history. The classic compounds take in excess of 100 years to degrade. So low-level inflammation is part and parcel of our lives, unfortunately.
Great, thank you. Next question is, how about broken sleep? How does one have healthy sleep when you wake up a few times during the night?
A few times in the night is not going to be too much of an issue. Now, if you're waking up and you're staying awake like an hour or so in those few times, then you may want to see a sleep physician to see if there is actual sleep disorder going on that you can get maybe some treatment for. But waking up 1 or 2 times a night is natural. Actually, everybody has micro wakes during the night. I think about 5 a night, pretty much, if you don't have any sleep issues. So it's not necessarily this kind of, you need to be in the bed for 8 hours continuous, no movement, no waking. It's not, that stringent at all. So I don't think that 1 or 2 awakenings is going to be too much of an issue. As long as you feel refreshed in the morning, then it should be fine. And if you don't, then you might want to look into seeking a doctor to see if there's any sleep disorders there.
Great, thank you. Making me feel better. All right. For the sake of time, I'm not going to be able to read everyone's question. Traffic out there is going to be murder. So one last question. Are any of you aware of medicines approved for early stage of memory loss that helps improve sleep patterns? For example, Donazepam.
Early stage.
Did I read the question again?
Yep, so the question seems a little mixed
Yeah.
because it's asking about early stage memory loss and sleep. I was wondering if there, there was a clarification if it's memory loss due to a sleep disorder versus memory loss due to neurodegenerative disease, such as Parkinson's or Alzheimer's.
Is the author of this question here? Oh, would you like to clarify?
Yeah, that's a very disrupted sleep patterns are very, very common in neurodegenerative conditions, and there are a multitude of different medications that can be helpful to aid in sleep in the face of a neurodegenerative condition. But there isn't one that is specifically approved to be given in early stage dementia per se. That really just depends on the individual and what the nature of the sleep problem is, if they have trouble with sleep initiation or sleep maintenance, et cetera. And so it wouldn't hurt if there's a kind of consistent sleep problem to do what Dr. Turner recommended and maybe have her go to a sleep medicine doctor that can work hand in hand with her neurodegenerative specialist to try to find the best medication for her.
Okay. Well, that concludes our question and answer. Thank you all very, very much. Really appreciate it. Joy, I'm going to turn it back over to you.
Thanks. So before we wrap it up and let everybody go, thank you all. And I want to give everybody an opportunity to say a final statement, a takeaway, a tip of the day. You've given away so much rich information. And I think that we all share concerns about our future, right? How can we make sure we're doing what we need to do so that we can have the best quality of life as long as we're here, right? So if you want to wrap up and give any more nuggets, that would be great. I'll just start with you, Dr. Turner.
I'll just say that it's never too late to improve your sleep. So I think it's just the best wrap up there is for that one.
I'll leave you with, for the environment, I believe that improvement of your core is probably a huge predictor of whether you will be stable and whether you won't slip or fall. So while people say exercise and keep your musculature, the core is the most important. And the easiest way for you to test your core today, when you go home, can you brush your teeth on one foot? And if you can, I promise you have a good core. If you can't, you probably start to work on your core.
I'm going to try that.
Your challenge.
I think the only thing I'd leave everybody with is awareness and education are the best and most productive thing you can do. So stay connected with what's going on out there because it changes so quickly and things are constantly getting created and changed, studied. So being aware and staying connected and educated will go a long way.
Take care of your cognitive and emotional health. There are treatments that work, and please go exercise.
I've often gotten kind of frantic trying to accomplish very worthy goals as regards the environment, what have you. So I heard something a while ago that I really responded to. Maybe you'll like it. Don't just do something, stand there. What I mean by that, and again, there's plenty of activity that I have trying to prevent homelessness and to work for the environment, to make the environment better and all that is fine. But it's like put your mask on first before you help the person next to you. Get yourself centered, get yourself in a still, present place where you're here, again, this moment, this one right now, with all of you, get centered and serene, and then go about the difficult jobs we have in many areas. Thank you.